Hi, Dr. Gullberg here, internal medicine series talking about GI bleeding. 2/3 of your patients in the hospital are going to be in with GI problems or cardiac problems. Certainly in the outpatient clinic, we see a lot of people with GI bleeding. So let's divide up GI bleeding basically into 4 areas. Number 1, melena, where the patient complains of tarry black stools. When people have melena, the bleeding is coming from above the ligament of Treitz in the duodenum. Primarily, it's going to be related to peptic ulcer disease or some type of an AVM in the stomach. If they have peptic disease, obviously we're looking for Helicobacter pylori infection, and these patients are frequently going to need EGD for diagnosis and to help in setting up the treatment. The second area of GI bleeding that we see is when the patient complains of a wine-colored stool or a dark purple stool. These patients generally are having GI bleeding in the right colon. Angiodysplasia is frequently the cause here. The third cause of GI bleeding is bright red blood in the stool. And there's 2 big areas here. Either if it's a voluminous bleed where there's more than a half a cup of blood at a time, that's more related to diverticular bleeding. Stops as often as fast as it starts. The other, of course, is just where there's bright red blood on the stool itself or dripping into the toilet bowl. And those are usually related. That bleeding is usually related to hemorrhoidal bleeding. The fourth area is just where on a routine physical exam you find guaiac positive stools. This is usually related to colonic bleeding, either AVM in the right colon or some type of a colon polyp, though of course patients can have silent peptic disease as well. So those are 4 key areas of GI bleeding that you have to be familiar with when you're working this problem up. And of course your gastroenterologist is going to be assisting you in making that final diagnosis. Thanks, Dr. Gullberg, signing off.